The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference.
I'm Susan Brender, and this is the Susan Brender Show. You know, today we have a really great guest. Her name is Renee Balcom. She's a professional health advocate. And I have a story about an advocate who was very important to my cousin, okay? Now, let me tell you the story. My cousin went in for quadruple bypass, and they put him in a small, tiny room. And the next thing you know, somebody with COVID was put in the same room. Now, can you imagine something like that? So my cousin, thank God that she was there, and she became an advocate for him. If she wasn't there, he would have gotten COVID. Now, think about that for a moment. What would that be like? It would be a real disaster. So I'm really happy to have Renee Balcom, who is an advocate, talking about what she does and what the name of her company is. So Renee, tell us, our audience, a little bit about what you do.
Susan, thank you. And again, thank you for having me. It's always a pleasure to be with you. I appreciate your work so much. I just want you to know that. As you mentioned, I am a healthcare advocate, a professional healthcare advocate, and I've been doing this now for about 14 years. And I kind of came to healthcare advocacy through this unusual route. Prior to this, I was the CEO of a tech company in Silicon Valley. And just through a series of life events, I found myself working in the adult care industry. And in that industry, I saw so many gaps and so much need for people to have assistance and a voice. And so again, through a series of events, I started my business, Renee and Company, and became a professional healthcare advocate. I have 5 healthcare advocates that work with me, and we specialize in the whole spectrum of care, everything from caring for chronic disease all the way through the aging process and our most delicate citizens and our seniors.
Let me ask you something, Renee. You do this advocacy. If you didn't do it, what about the people, the elderly people? What would they do if they found themselves in a situation that was really critical?
Well, I tell you, unfortunately, medicine is not kind to us as we get older. In fact, it can be very dismissive of us. And, you know, we've all heard those adages of, you know, well, it's just part of getting older. And to be honest with you, I don't believe in any of that. I think that we are all human beings that deserve to have the best, and I say the best, medical care available to us, no matter what our age is, no matter what our financial situation is. So as a healthcare advocate, I just don't buy into, you know, well, she's in her 90s and she's not going to live forever, because I don't think that's medicine's call. I think that's, you know, God's call. That's our Creator's call.
Tell us this little story, Renee, about one of your clients and why she came to you.
Well, in fact, talking with you makes me reflect on a quiet client. He's my client now, but when I started working with Chuck, his name's Chuck. When I first started working with Chuck, he was 87 years old, and he was living independently in his home, and he had private caregivers coming in, and someone recommended me to him. I think maybe Adult Protective Services or something like that. I'm not sure. So I went and met with Chuck, and one of the first things that I noticed was Chuck's bank statements were sitting open on the table. And when you have a lot of traffic coming in and out of your home, especially strangers, I think it's always important to put those important documents away and not have that information available to everyone that comes in. Chuck had used a catheter, and he had gotten sepsis a few times, and just wasn't seeming to get the level of care that frankly he was paying for. So he hired me as his healthcare advocate. And, right away I started helping him get his home in order and making certain that we were offering him some security and some safety and that he was getting appropriate care. Well, in pretty short order, Chuck was back in the hospital and he was very, very sick. He ended up with a blood infection because this catheter wasn't being cared for correctly. And they treated him in the hospital for about 10 days. They discharged him to a skilled nursing facility. And I was visiting Chuck, but he wasn't necessarily coherent and responsive. And one day, about the third day he was there, I had a nurse stop me in the hall and she said, you need to pay more attention to what's happening here. And honestly, Susan, I was really taken aback by that. And I said, I'm sorry, I don't understand. And she said, they're putting trays in front of him 3 times a day, but he's not able to eat. So he's basically starving and no one's helping him.
I'll interrupt you, Renee, because here's the thing. Years ago, people literally lived right next door to their relative, to their grandma, to their grandpa, to their sisters, to their brothers, and they had that advocate. Now, today, a lot of people are all alone, right, and they have nobody. So when we know that, is there a way that they can take care of themselves without an advocate? Is that possible?
There is, yes. I think being knowledgeable and understanding how to have your own voice with your healthcare practitioner. But I think it's also really, really important to have someone that's in your corner, whether it's a friend, a church member, a relative, or even a professional agency that's there to help you. In the case of the man I was talking about, he doesn't have any family. So he didn't really have anyone to look after him except for these caregivers that he was paying that, honestly, we discovered was stealing from him, just as I suspected the day that I met him. So, but the long and short of the case with Chuck was I was able to influence his care, even in that skilled facility. I stayed there. I brought caregivers in, my own caregivers. I brought them in to look after him, and we started getting nourishment in him. And you know what? Within 3 days of that time, so 6 days, he left and he went home.
Oh, that's terrific.
But the flip side of that is, had I not first of all, had the nurse not stopped me and made me aware of what was going on. Second, had I not stepped in and brought in 24/7 care for him, which, by the way, was not necessarily sanctioned by the doctor. The doctor and I really had words, and he told me, he said, look, this man is elderly and he may not get out of here. And I went to Chuck and I held his hand and I said, Chuck, I think they're trying to get you off the payroll. I said, are you ready to go, or do you want me to get you out of here? And he squeezed my hand and he said, get me out of here.
Sure. What about Medicare? What about Medicaid? Does it do the trick? Can you get an advocate through that?
No. And they don't pay for an advocate. Medicaid may, depending on the circumstance, but I'm really, really glad that you brought up Medicare and Medicaid, because it's very complicated and it's very layered, and it changes all the time. It changes every year, and we're in the state of change with that system right now. There's a new program they want to launch in 2023, which they're referring to as value-based care, and that's in lieu of fee-for-services care. So are you aware that your doctor gets incentives for your care by Medicare? Do you know that?
Yeah. I'll tell you something. One of the things that happened to me, I'm going to give you my little personal account of things, is that I got a bill in the mail and I called Medicare and I said to Medicare, what is this all about? I had no idea. And it turned out it was a scam. Yeah, it was a scam. Somebody sent me a bill which I didn't even know who it was. And it was a really big bill. So needless to say, Medicare helped me. But if I had somebody like my husband helping me, it sure would have been faster, because it's not to try to wiggle your way through Medicare or Medicaid is not an easy thing.
Right, right. And I'm glad you brought that up. Last year, what it was documented that $26 billion was scammed out of people 65 and over through what was presented as Medicare services or care services. So that, unfortunately, we have so many predators in our country that are really focusing on the aging population or the chronically ill population. And again, that's where I think a healthcare advocate, someone that has and especially for people that don't have those family supports or those friend supports, someone that can, kind of sit down and say, oh, this doesn't look right, or this is odd or unusual, I think can be really beneficial for most people.
Now, I don't know what your political thinking is, but do you think now with our president and in our Congress and our Senate, they are doing what they need to do for elderly people?
Absolutely not. No. And in fact, I see them moving Medicare services and services for our aging population to the immigration population and some of the other special interest groups in our country.
Wow.
And I see it happening pretty rapidly.
So the immigration situation, I'll tell you another story. My friend's daughter is a PA at Columbia Presbyterian Hospital in New York, which is a very, very fine hospital. And she said to me, people who have nothing, she's talking about immigrants or other people who are really poor. She said they call up an ambulance, and they even call up if they have a hangnail, and they get there to the hospital and they never pay. So, we're dealing with an immigration issue here. Now, Renee, you mentioned that the immigrants are the ones who are getting everything. Is that true?
It's pretty true. Yeah. I would say, the huge influx of immigrants that we have coming into this country, frankly, it's very lucrative to be an immigrant in the United States. It's not so lucrative to be a 75-year-old female that worked the last 30 years and is trying to get by on Social Security and Medicare. That's not very lucrative. The other thing that's pretty lucrative is being a part of the prison system and being an inmate, because you can get a lot done as an inmate. Now, I don't encourage anyone to break the law so they can go to prison.
I hope not.
Some of the best medicine that you can get in the United States is in prison.
Yeah. That's really interesting. Something's wrong with our system. Our system really has to change. Now, if you had an opportunity to make it that change, what would it be?
Well, one of the things, and listen, I've been an entrepreneur and I've been in business my whole life, and I'm a big supporter of that. But one of the things that I would change, number one, is I would put term limitations on people that are in our government. I would also make our government, everybody, play by the same rules. Our government leaders do not live by the same insurance programs that you and I live by. So they don't use Medicare. They have private insurance, and they have the best insurance that's paid for for the remainder of their lives through the tax system. However, if I couldn't change that, what I would do is bring the Medicare system, kind of Medicare for all, but bring it up to a better standard, because Medicare does work. It can work for us, but as soon as we open up a competitive medical environment like the Medicare Advantage plans have done, we start seeing a lot of confusion and a lot of misdirection of services. We all see those commercials. Some of our most favorite celebrities are, touting some of the Medicare Advantage plans, and that just adds another layer of confusion in this federal healthcare system. And so I would advise anyone, don't believe what you're seeing on TV. Don't believe all that information. Everyone should take the time to look at these policies and understand it's an investment in their health and in their life, and not just trust what a commercial tells them, because in most cases it's not accurate.
Yeah. We've gone through a very tough time. We've talked about this before, but the truth of the matter is it really was a tough time. But a lot of the people were all alone for such a long time, and they had developmental problems, anxiety, and all different kinds of problems that really made a big difference in their lives, and it's not a good difference. So when you deal with some of the elderly, do you find that loneliness is one of the problems?
Yes. And I happen, as a healthcare advocate, I happen to have a specialty in behavioral health, which includes depression and cognitive decline and the whole spectrum of behavioral health. And I've definitely seen our senior population, they're isolated, they're alone, they're frightened because you can't turn on the TV without having another major crisis in front of us. There's oftentimes the COVID has put so many seniors in this isolation that depression is just going to automatically come in. I live in California, and in Sacramento, California, and we are in assisted living now and independent living communities. They're isolating again because of a new round of COVID that's coming out. So all of these people that are paying, $6,000, $7,000, $8,000 a month to live in these facilities are now relegated to their rooms, and they can't cohabit together, which is what they're paying for.
Yeah. Are you associated with any psychiatrists or psychologists so you can give them the opportunity to get everything off their chests?
I do. There's a couple of really great programs here for seniors, therapy programs. Psychiatrists pretty much issue prescriptions, and I would, if it's necessary, psych med, should be taken. But if we can avoid that and really assist people through therapeutic methods and just giving them some coping skills, I prefer to work in that environment. But yeah, I do quite a lot of work in the psychiatric environment. I have a client right now that is, I have her on a hold because she's a potential harm to herself, and she's 70 years old.
Wow, that's a shame, isn't it?
Well, I have to tell you, we think about psych holds as being punitive, but they're really not, Susan. You can take someone that's in crisis, and you can ask, take them to the emergency room, ask for a psychological evaluation, a potential hold because they're a potential harm to themselves. And sometimes just that 3-day hold gets them the medical care and the medical treatment that they need to be able to move forward in their life, right? So it connects them with the therapist, it might connect them with the psychiatrist, and it can really, really be a great resource for people. Most of us are afraid of psych holds because we think it's punitive, but it's really not.
Yeah. Renee, there was a time where there was a kind of, I guess it was called an organization of some sort, where people called each other and made sure that everything was okay. Does that still exist?
Well, again, I'm in California, and we do have, they have an 800 number for people that are dealing with issues from COVID and depression and some of the isolation concerns due to COVID. Also, for people that are dealing with the loss of a loved one from COVID, there's this new phenomena that's come out of the pandemic where it's severe depression because of losing a loved one so abruptly, or not being able to bury them as they should have in an appropriate way. So we're starting to see some supports for those kinds of depression and those kind of maladies.
Yeah. A lot of people who are elderly, I see them, I live in Florida, and Florida has a lot of elderly people. And the one thing that they say to me all the time is that we wish we had somebody left, because most of their friends, their family are gone, and it's a horrible thing for them. Now, with that said, is there another way to really get through to them and help them do what they need to do, which is to take their medications, to not listen to the media? And that is another question that I have for you. Is the media paying enough attention to this problem?
Well, let me answer your first question. I think as a community, the best thing that we can do, we live together in community, is go out on our porch every morning, look across the street, look to the left and look to the right, and just not get in our neighbor's business, but just get a sense of their well-being. And it's amazing what we can see just from our front porch. And if we see that Mr. Smith's papers haven't been picked up, and we know he normally does, go over and knock on that door and find out, how are you doing? If you have an elderly neighbor and you're going to the grocery store, it doesn't just make them feel good, but it makes you feel good to say, hey, I'm running to the grocery store. Can I pick something up for you? Right? I mean, we have to get back to being community and caring for each other and stop some of the self-imposed isolation, right? Because that's what we've done. We've become so siloed in our day-to-day life that we don't pay enough attention to each other.
It's an interesting thing, Renee, that if you're in Europe, for example, the families are all together. Mm-hmm. And I said this before, everybody has somebody. But here in America, we're spread out. Our families live, like you said, in California, New York, Pennsylvania, you name it. But how do you then have help, advocates? And you're one, and you chose to do this. Now, are there a lot of people who come to you and say to you, thank God that we have you?
Well, I actually have, I have so many people that have shown gratitude to me for the work that I do. And there is a National Healthcare Advocates Program that it's literally that, National Healthcare Advocacy Association, that there's probably professional advocates in everyone's area. Unfortunately, we're not paid for by insurance, and depending on the advocate, it can get a little expensive. But there's also, you can reach out to your health and services department at your state and county and see if there's services there. And then I'm starting to see a lot of like senior resource centers opening up. And I think this was indicative of COVID as well, where they're combining resources in kind of a one-stop shop where, maybe you'll share a caregiver with someone else, right? And you'll invest together in a resource. So most of us don't need someone to run errands for us or to be available to us every day. But imagine if you had, an individual, and you and a neighbor and maybe a couple of friends or whatever it is, whatever your community is, shares in the expense of that person. And maybe they see you a couple of hours a week, right? So we're starting to see those kinds of services pop up through the senior resource centers.
Yeah. Now, you just said that it's not cheap to have an advocate, but on the other hand, it pays for itself in a way. Right. So when people come to you and they say, how much do you charge? You don't have to make any excuses. The fact of the matter is that you're worth it. So the point is, if they have a little bit, this is the most important thing that they should concentrate on. And do you let them know that? I
do. And I try to work in a managed budget. Obviously not everyone can afford our services. I also set aside 10% of our monthly revenue and do benevolent work. And so I do free services. I have a client I'm working with right now that I'm doing that. But, back to our little man, Chuck, right? Chuck tells everybody, when I'm in his presence, he tells everybody, she saved my life. She saved my life. And Chuck is alive today. That incident that I mentioned happened 5 years ago. And Chuck is alive today at 92, just had cataract surgery last week. He cannot believe how much better he can see, and he's thriving. And so for him, you know, what he pays me, which is runs about $600 a month, he feels like is well worth it.
It sounds well worth it. There's no
And
question about it.
You know, he calls me his person, like that's my person. You know,
Almost like a relative, I bet, Renee, huh?
and I have the authority when Chuck is ready and he decides to transition from this world. And he and I have spent time on this. When he's ready, I have the authority to allow that to happen if he can't work it for himself.
Yeah. Now, if there's a question that I missed, is there something that you want to tell our audience a little bit more about what you do and how you do it and what difference it makes in people's lives?
Well, I will say this. Statistically, they're saying by the year 2035, 1 in 5 adults over the age of 65 will not have family supports. So 1 in 5, that's a big number.
It's a very big number.
And I think that I would encourage people to start planning for that. Everyone knows who we are. And if we can project ourselves out into the future and we say, you know, I don't know if my spouse is going to be with me in 10 years. Or vice versa. I may not be with my spouse. And you just kind of start projecting into that, which, by the way, Susan, none of us are good at, right?
Right.
You know, they say for every funeral home will tell you that 75% of everybody that walks into a funeral home, no matter what the age is, they didn't pre-plan. There was no pre-planning done. We all know at some point we're going to die, right?
All right. But here's the thing, Renee, when you say pre-planning, what do you mean?
Well, you can go to the funeral home. You can make all of your own plans. I did this with my mom, by the way. We went to the funeral home. And it was, they made it so pleasant. I was blown away at how pleasant it actually was. And we made all of her plans and we paid for it. We paid for it you know, we did this 5 years ago. We paid for it based on the cost then. And I think it was even a little payment plan for like a year. And she's all set and tucked in. And I know exactly what her wishes are. And it's all budgeted, right? And most of us fail to do that. Myself included, by the way. I mean, I could, you know, I don't plan on dying anytime too soon, but I could get hit by a bus tomorrow. And I haven't paid for my funeral yet. And honestly, it wasn't, my mother paid like $2,500. Right. It wasn't expensive.
Well, here's the thing, Renee. Another thing is very important is that our press, okay? Now, you're very fortunate. You work with a person by the name of Rick Bava, who has a magazine. But I think you should write an article which really tells people how to really prepare for the end, if you will, or not even for the end, how to prepare in general. Don't you think so?
Yeah, and I actually am in the process of writing a white paper, and I'm going to start doing more publications like that. I'm also in the process of designing an app. I'm having an app. I'm not designing it myself. I have engineers that are, because what I want to do is be able to put some direction in your cell phone. That if you want to write a care plan for yourself, or you want to bridge some of these gaps in your life for yourself, that the app will instruct you not only how to do that, how to be your own advocate, but also what vetted resources in your community can help you. And those fully vetted resources, we vet our resource every 12 months. So we can start flushing out some of the bad actors that are in the senior care industry.
Well, our guest today has been Renee Balcom, a professional health advocate who really is doing a marvelous job and make people aware of what is happening around the world with regard to elderly people. Would you tell me how people get in touch with you and what your book is all about and where they get it?
Of course, thank you. I'm Renee Balcom. My website is reneecompany.com, and you'll see all of my associates and the other advocates that I work with there. Any of my media or any of my books are also listed on my website. So it's Renee Company, spell that out, RENEE, company.com. And my book is called Raging Aging, and you can get that on Amazon.
Well, it's been a pleasure to have you on the show, Renee, and people need all the help they can get. So thank you very much for being on my show.
Thank you for having me.